Dr. Wayne McCarthy, would you mind explaining just how Prolozone is working? Is this very applicable for shoulder and knees, is it?
Yeah, Prolozone is prolotherapy using ozone, and it's for strengthening ligaments, cartilage or tendon attachments. And if you've had a knee injury or a sporting injury and you've no doubt tried, you've had your osteopathic treatment or chiropractic or physiotherapy, acupuncture, massage, Bowen therapy, there are many soft tissue therapies that work extremely well, and you'll no doubt get some improvement. But if you find that the joint pain returns, it's probably because it's a ligament injury, in which case Prolozone is a permanent solution for that. Basically what we're doing is we're injecting the damaged interface between the ligament and the bone, and we're growing new ligament to reattach more strongly to the bone. I like to use the analogy like seaweed attaches to a rock. Then you can pull on that ligament really hard with muscular contractions, exercise, and it'll be up to the standard. It will be able to take that strain. Hence, you've got no more joint pain. So it's a permanent solution for all sporting injuries. And a lot of our patients come with diagnosis of osteoarthritis. What we've found in many cases is that yes, there's osteoarthritis, but that may not be causing the pain. And we'll on examination, if we can find that there's soreness to deep palpation or deep touch, we're actually pushing on a damaged ligament, in which case we can inject it and it will get back to full strength. Prolotherapy or Prolozone means proliferation therapy. It proliferates the damaged tissue and makes it as thick and as strong as normal. After the treatment, it takes 3 weeks to get to full strength, but most people experience almost immediate improvement.
And have you been treating lots of people with this over the years?
I've been doing prolotherapy for about 16 years at this point, and in general it has over a 90% success rate, as long as the diagnosis is correct.
And what are the main treatments you're using? Is it for knees, shoulders?
The most common treatment probably is either low back or knees, and then after that you'd have rotator cuff shoulder problems, and then perhaps after that elbows. But by far and away it's low back pain and knees and hip pain that's the most common presenting symptoms.
And these are people who otherwise would often have to have an operation?
Sometimes. Many of our patients have been offered hip replacement or knee replacement. Many of them haven't had to go and do that because after prolotherapy they're experiencing no more pain. So the way I like to sort of put it is you've got a continuum of soft tissue therapies, which I mentioned earlier. Then there seems to be, if physiotherapy doesn't correct the problem, then the next step is to go to surgery. Well, there's a big gap in there where there's nothing really offered, and that's where prolotherapy comes in. It's up here somewhere. For many people, we find that the prolotherapy, because it removes the pain and restores function, it obviates the need for surgery. This is particularly good for people who are on a long waiting list. They're in pain, but their doctors have told them that, we're not going to do a surgery until you're really bad. Well, that you might consider doing prolotherapy in that case. If it doesn't work, it won't do any harm.
Stop.